I just finished a wonderful episode with Dr. Brittany Lamb, who is such a delight to have a conversation with. And I will admit, as a qualified healthcare professional, there was so much that I learned from Brittany related to making decisions for and with someone who is not able to make these decisions for themselves anymore. I invite you to listen to this episode and truly consider Brittany's offer at the end of the program to use the coupon that she is giving the listeners of this program so that you can actually get this done for yourself. Because I know for me, there was a lot that I learned from her that I did not consider before. And I will be getting this program and I will be doing it with me for my parents so that I can truly help them direct their care better as they are unable to eventually make some of these decisions for themselves. So check out today's episode and really honestly take Brittany up on her offer for the coupon code and go and do the work now so that we don't have to do the work later on. And listen very much to this wonderful episode. Hey there, success seeker. Welcome to Dementia Caregiving for Families. Do you feel overwhelmed with the daily struggle of dementia caregiving? Looking for an easier path? You're in the right place. On this podcast, we teach you the skills to simplify caregiving. We unravel the mystery of dementia and guide you through the often difficult behaviors. I'm Lizette, your host and fellow family caregiver. As an occupational therapist, I bring my professional and personal experience to this community. Here we speak the truth, but without the verbal vomit. I know you will find value in today's program, so buckle up while this flight takes off. Well, welcome back to today's episode of Dementia Caregiving for Families, and I'm very excited to have my very first physician on the program today. Her name is Dr. Brittany Lamb. She is up in Virginia, and we met online, and I'd love for Brittany to tell me and to tell you guys a little bit about herself and then why she decided to come into the online space to help people make medical decisions.
Yes. So, my name is Brittany Lamb. I'm an emergency medicine physician. So I've been practicing since 2014. That's when I started residency. And I live in Northern Virginia. But basically, I saw a lot of people struggling to be an advocate for a person who is aging, who is unexpectedly not able to make their own medical decisions. And then especially for people who are living with dementia, who we know as diseases that are causing dementia progress, it is expected that a person will at some point no longer be able to make their own medical decisions. And I think it's really hard to make medical decisions for somebody that you care about. You want to do the right thing. You don't want to do too much. You don't want to do too little. You want to honor them. And I think that there's not enough time in the healthcare system to be able to teach people what they need to know. Our visits are so short. And I just really was inspired by seeing so many people teaching online and becoming frustrated with their job. And so coming online because of burnout in some ways. I did actually suffer from pretty bad burnout a few years ago, right after COVID. And
I don't blame you there.
yeah. So in the ER, and it's just a very fast-paced environment, and I love to teach. So that's why I came online. I really feel like there's so much that people need to know in order to make informed, confident decisions for their person living with dementia. So that's why I'm here.
Wonderful. So as we were talking before we started to record, you and I briefly talked about capacity versus competency. And even me as a healthcare provider, I'm like, what's the difference between a person who is incompetent versus a person who doesn't have the capacity. Will you explain that to us,
Yeah,
please?
absolutely. So I'm not an attorney, but I'm a physician. And so typically the term competency is more of a legal term. And so in the setting of when someone needs a guardian or conservator because there hasn't been someone named, maybe they're not making decisions that are safe or appropriate, and someone really needs to step in and take over, they can be declared legally incompetent, which means that a person has permanently lost their decision making capacity. So basically, the terms kind of mean the same thing. It's, can you understand the choices that you are making? You can weigh out the risk and benefits of the different options and then be able to explain why you're making the choice that you're making and how it could affect you going forward. So people have to have capacity to make their own medical decisions. They have to have capacity to be able to sign legal documents like your advance directive,
Mm-hmm.
living will, or five wishes. People have to have capacity. And the thing is, medical professionals, we assess capacity kind of in an informal way.
Mm-hmm.
So it's not, there is, in the emergency department, I don't pull out a piece of paper and go through like a protocol for assessing someone's ability to make decisions. And sometimes it's, do you know where you are? Do you know why you're here? And so it can be hard for people who are speaking on behalf of someone else to convey that that person doesn't have the ability to make decisions when they can still have a seemingly normal conversation.
Mm-hmm.
So, but capacity fluctuates. And so it's something where you can have the ability to make decisions at one time of day. And like I was saying to you, it's like people who are earlier on in the disease oftentimes do better in the mornings, and then their symptoms of dementia get worse as the day goes on. And at the end of the day, they might not be able to make their own medical decisions. And then the other important thing about capacity is that you can have capacity to choose what you want to eat or what you want to wear, or if you want to go outside or not, but you might not have the capacity to make medical decisions. And I can talk a little bit, if you're interested, about the actual process that we need to be able to do to have capacity to make medical decisions.
I think that would be very helpful for people to understand, because I know a lot of family members in my years of working with people that believe that the person has the ability to make that decision when it's obvious that they cannot even make a simple choice between wearing a red shirt or a blue shirt. And so I understand, as a family member, you want to give the person you love the ability and the autonomy to make those decisions, and certainly do it for as long as they're able. But there is a tipping point when a person should not be making those decisions. And I think it's helpful for other people to understand how to look at it so that they can be better prepared to realize whether somebody has the ability to make those decisions.
Yeah, it's something that I see very commonly in the emergency department. I think innately we don't want to have to make medical decisions for somebody else. We want people to make their own choices because we don't want to do the wrong thing.
Mm-hmm.
And so I think that's part of it. And you also, a lot of times you have people who are speaking for their parent, and your parent was the person who helped you make decisions. And now you're making decisions for your parent. It can feel very unnatural. Same thing with spouses. So, but when we make medical decisions, we have to first understand the actual situation that we're in from a medical perspective. So what's actually happening to us, right?
Mm-hmm.
Then we have to understand what each of the treatment options are available to us to deal with whatever situation we're in. We have to be able to listen to and understand the risks and the benefits, the pros and the cons of each of those options. Then we have to make a choice based on what is best for us, and then be able to explain why we are making that choice. It is not an easy thing to do. It's
That's very complicated.
Exactly. And you have to be able to see how those choices would impact you. And for a person who has very little short-term memory, they're not going to be able to predict out what is likely to happen to them in a lot of instances. So I think people need permission in some ways to go through this process and think about this. Can my person actually do these things? if your person cannot do these things, then you are making their medical decisions or whoever has been named. So yeah, it's important to realize and recognize.
So how would you advise a family member who is now listening and comes to the realization that, oh, my mom really should not be making those decisions for herself? How would you advise them to start? What would you recommend that they start to think about doing? Did you know that caring for a person with dementia doesn't have to be this hard? If you are struggling and you would like to join our next free workshop, the topic of the workshop is 3 tips how to avoid challenging dementia behaviors without stress, anxiety, or burnout. I invite you to walk away with science-backed dementia caregiving skills that many professionals don't even know after attending this free workshop. If you'd like to register, message me the word workshop on Instagram or check out the link in the show notes below.
Yeah, so I have several resources on this. I mean, I recently put together a training for how to avoid the top 3 mistakes I see decision makers falling into. And I also have an audio training that kind of walks people through the steps of being someone's medical decision maker. But I think that when you realize that you're in this role, it's, gather any information that is going to help you be able to speak on behalf of the person. So do you have documents like a living will, 5 wishes? Do you have a medical power of attorney form? I think it's really important that you start trying to figure out what your person's goals of care would be. And this is the topic that I could talk about for a long time. Like I could have a conversation with you about goals of care all day long. It's a little bit complicated. There's 3 different goals of care, and it's basic. What it comes down to is basically what a person's value is of quality of life. Quality of life versus length of life. And so starting to think about that. The other thing is actually taking inventory into what medical issues this person has, because people who are living with dementia are at risk of every other medical problem, just like anybody else. And a lot of times, we're people who are aging, who are being diagnosed with dementia, and even early onset, we're all aging. Every single one of us, we're all aging. So, understanding what your person is at risk for because they're aging. I think taking inventory on those things that's kind of where I tell people to start. And then I advocate that people make decision plans. So actually looking at what the person is most at risk for from a medical standpoint, using their goals of care to know like what's okay and what's not okay, and what's okay now, but what might we need to adjust in the future if their quality of life is important to them and they're having worse quality of life. A lot of people want less aggressive medical care as their quality of life gets worse to them. So that's like a very high level overview. I could talk about all of those things a lot.
Oh, I'm sure. I love this. It's fascinating. So I find it interesting. I'm not one of those shy people. So when I go with my mom and dad to the doctor, I can be a little bit of a advocate for my parents.
That's good.
But it's been very interesting because sometimes the physicians don't recognize that the person doesn't have capacity.
100%.
And that has been very frustrating for me because I know that my mom doesn't have the capacity to make certain decisions. And then her doctor tells me she does. And I'm like, you don't talk to her more than a couple of minutes and you're asking her the same questions that you've asked her every single time she's come in. And you don't have those conversations sitting in the living room where she's like, I don't want to keep living like this. So what would you say to families who do recognize perhaps that their person has less capacity and then runs into a medical professional on the other end that doesn't? How do we advocate then
Yeah, it's so common. My mother-in-law ran into this issue with trying to get her mother diagnosed. She wound up being diagnosed with vascular dementia,
Hmm.
but the diagnosis was delayed because she couldn't get in with the doctor. Like the doctor didn't trust her and didn't believe her. And so, it's frustrating. I think one is being aware that this is possible to happen. It's not uncommon. It happens, and it's because the person doesn't have the same level of understanding of who your person is at their root, and what's normal for them and what's not. And so I would say that if you know you have a doctor's appointment upcoming with your person, I would start to actually maybe document things that support your argument that your person really doesn't have capacity.
Hmm.
And I would try to reach out to the office staff before the visit so that you can, because here's the thing, everything is so rushed and fast paced, right? And what you want to do is you want to give that person as many opportunities to as many like brain tipping points or trying to get them to realize that there's an issue here. And so if you communicate with the office staff and you're like, I wrote this letter, I want you to read it before this appointment. Then if you get there and they didn't read it, you have a copy of it. And you say, you probably should read this before you have the doctor read this before they come into the room really quick. Don't write like a 10-page letter.
Yep.
Bullet point out what you're concerned about and what you've noticed and remind them that they can have a normal conversation. They still have X, Y, and Z abilities, but these things they do not have. And these are the things I'm having to do for them on a day to day. So there's an issue. I think if they won't listen to you and you don't feel supported, I feel like another doctor, another office, finding another place that you can go either through a local support group, the area agency on aging, somebody else that you know who's been in this situation. You have to advocate and step up because the healthcare system is so protocolized and it's
Hmm.
so like time sensitive. Everything is so rushed and hurried that that's what I would say to start.
I 100% agree with you. And I love doctors dearly, but I've come to the realization like your primary care physician, they're in a very untenable position, to be very honest. The expectations that they have are unrealistic to manage all of these different people in all their different conditions. And truly they function more like a clearinghouse. You go to the cardiologist, you go to the podiatrist, you go see pulmonology, and they're the catch-all for a lot of the more common types of conditions. But when you're dealing with dementia, and you yourself know, because I know you specialize in it, there's so many different types of dementia, and a primary care physician is not equipped to actually make the diagnosis, a
No.
proper diagnosis of dementia with a person.
Yeah, it's going to be pretty rare. I think there are probably some primary docs that are interested, and then maybe they have
Yes.
had family members or they've gone and done extra training, and so they do feel more comfortable. But it's becoming more and more common. I think things will change as we graduate younger doctors. But yeah, primary care is really, really tough to operate inside. And so I think we need more geriatricians, but
Yes.
I think that that's something to consider when you're looking for a doctor and maybe an internal medicine doctor and if the finances allow looking for a primary care who does just dementia like direct pay or concierge kind of thing if funds allow.
Right.
But I think that looking for doctors who take care of a lot of people who are aging, who understand that they're like farming you out to these other specialists, and it's incredibly important for one person to take ownership and look at the
Hmm.
big picture. And that's what I really teach my clients to do because it's basically like teaching them things, informing them so that when they're in with the primary, they're in with specialists, they know what to ask and what to say and how to advocate. So yeah.
I love that you talk about a geriatrician,
Yeah.
gerontologist.
Yes.
But there aren't enough of them
No.
out there. And the concierge doctors, I think they're very valuable for the people who can do that. But I also understand it's not accessible to every person.
Yeah.
As like I'm a daughter of two parents who have cognitive impairment. if you were to meet me, where would you tell me to start?
I think I would ask you, well, I would ask you a bunch of questions. So I would want to know, are you living with them and what's the situation? What are you struggling with? What's the biggest frustration in your day? Because I usually tell people to tackle the thing that's causing them the most frustration and stress. But when it comes to navigating medical decision making for someone else, I think that it's important to have conversations. If somebody has mild cognitive impairment, it is incredibly important to figure out what their values are of quality of life. And so, do they care about quality of life or do they care about length of life? And if they care about quality of life, what exactly does that mean to them as a person? And one thing that you can do for a parent, or a spouse who is earlier on is just talk with them about what do they do from when they wake up in the morning to the end of the day. What is their perfect day? What is a day that would make them happy and feel like, feel joy? And then when they start telling you, start asking them why. Why do you wake up at 8 o'clock? Instead of just like jotting it all down. And I think also remembering that the root of all medical decision making comes back to what a person values when it comes to quality of life. So if you only do one thing, that's the thing to do. And to really know that about that person. That's what I would say. But yeah.
I love the why decision.
Hmm.
I really like that. So my mom and dad have a very structured and routinized day. Like I can tell you exactly what they do when they do it. It's very structured. But I don't know the answer to the why.
It might just help you understand more about them and like what makes them tick. And so when you ask that, things come up
What kind
that
of responses do people give you about the
it's
why?
not this, and this is not some, this is what I tell people to do, but I don't do this with my clients because I still practice full time. So I have an online course that walks people through these things and I tell people to do these exercises. So I don't actually get to hear, but I've asked family members these things, because then it's if you have to take over for them, like, well, why do you like scalding hot showers? Because I don't like being cold. It makes me feel miserable being cold. Or, I want to stick my face in the sun in the beginning of the day because it gives me energy, and it's these things that then a person can't always verbalize to us and explain to us when they lose the ability to do that. And so it's like it can really, really help you care for a person on a day-to-day when you do those things. But I also should say that if person has lost the ability to have these types of conversations, you still have to determine what quality of life means to them. You have to do that work on their behalf. And so that's a little bit more challenging. But you have to do it. You have to sit down and think about what living actually means to the person. Because if you don't do that, as people progress and live with illnesses, we get used to the way that they are. We get used to their new normal. And we sometimes forget to look at the big picture and realize, oh, my person actually is living in a way that they may not be okay with. And if that becomes the case, then you are probably going to pick much different medical care for them.
Yeah,
so,
for sure.
Yeah.
So tell us a little bit more about the process of medical decision making, like a surrogate person making medical decisions.
Yeah.
Like somebody like me for my mom. Like I pretty much know my mom really well. And I mean, we have the healthcare power of attorney, we have all the papers and so on. But I also know my mom, she was 42 when she had a massive aneurysm. And she fought very, very hard when she was young to recover from it. Did exceptionally well, had another stroke. So the first one was a bleed. The second one was a clot. So she has had both types. Thankfully, it was in the same part of the brain. So she didn't have any other big signs and symptoms. Looking back, I can tell it did change her ability to function. But I know that she doesn't want to continue to live like this. So I very much am aware that if something happens with my mom, my decisions are to give her quality of life, not length of life. But I'm a fairly informed healthcare provider. For people who are not, how
Mhm.
would you tell them to start even thinking through some of the stuff?
Yeah. So I recommend when I ask people to first understand what they're taking on, the responsibility that they're taking on, and know how to step up and say that they're taking on that responsibility. That's a big thing to be able to tell medical professionals that I'm the
Hmm.
person, and this is why. Either because I was named in a legal document like a medical power of attorney or healthcare agent or whatever it's called in your state, or I'm the default person and I have a legal right to make my person's medical decisions because I'm their spouse or I'm their child. And like these are the other people that are in the woodwork or not. And if there are other people in the woodwork, then they all need to be on the same page, which is something that I teach people to try to do. Yeah,
Yes.
challenging, right? Um, but it is gathering documents, reading them, and realizing that they have tons of holes. So they don't tell you how to manage stroke. They don't tell you how to manage sepsis. They don't tell you when to come to the hospital and when not to, what medications to take, what doctors to go see. They leave all of that out usually. They just talk about end of life. So
Hmm.
that's something else to know. You have to determine your person's goals of care. So you've said, your mom values quality of life, but right now it's like, how would she judge her quality? You already kind of said this, but right now, how would she judge her quality of life? If she would say it's really good, then a lot of people would say they would like every medical treatment available, right? Until it
Hmm.
doesn't work. If they would say their quality of life is not good, then you have two options. It is looking at the medical issues that she is most likely to face and learning about how they're treated when
Hmm.
someone gets sick and might need to be hospitalized. And that's what I do inside of my course. I teach all the medical conditions that people living with dementia are at risk for because they're living with dementia.
Hmm.
But then the most common things that happen as people age, like stroke, atrial fibrillation, sepsis, lung failure, because of all the different reasons that the lungs fail. And if somebody's really focused on quality of life, we have to think about the medical issues that they're at risk for.
Hmm.
If somebody is would say that they don't have a good quality of life, but they would like to protect their quality of life, they may be okay with having infection treated aggressively. And there may be medical things that they're okay with and not. Like, so say she had pneumonia and her lungs failed from sepsis.
Hmm.
Okay. She may, I'm just saying, she may be okay with a short term in the ICU on a ventilator because maybe she's going to recover and keep her same quality of life or something similar to it, versus if she has a huge bleed in her brain and requires intubation and being in an ICU, or if her heart or lungs were the primary problem because of underlying medical issues with those. Like if somebody has COPD or congestive heart failure and they're already living on oxygen, then if that person's lungs or heart were to fail and they have decent quality of life, they may say, you know what? And we may say this on their behalf, right?
Hmm.
We may say, I don't think my person would actually want aggressive medical care because if they survive that, they're likely to survive with worse quality of life because they already have this medical problem. Whereas if we're treating infection aggressively, a person's more likely to recover from an infection and get back their quality of life. So I have a hard time when we make blanket statements about like no ICU, no intubation.
Hmm.
For some people, that's very reasonable. And typically that's when our goal of care is comfort. And so there's this middle goal of care, which is some but not all care. And it's based on the person's value of quality of life, what their quality of life has been like recently, and how likely they're to get back their quality of life with the different treatment versus comfort, which is everything is focused on comfort. So, and I could talk about that. I could keep talking about this for
Oh
so
no, I
long.
love this. And I'm actually really glad you brought up the example that you did about the pneumonia and potentially being in an ICU and maybe even being intubated
Yeah.
for a short period of time because about so it's been probably about 4 years that I've been my mom and dad's medical power of attorney. And it was only about 2 years ago that I actually got into their medical records because my dad got sick, right? So
Mhm.
for the first 2 years, they were just kind of floating along. But when my dad got sick and he had COVID, went to the hospital,
Mm,
cuckoo for Cocoa Puffs, the whole 9 yards,
mm,
diagnosed with MCI afterwards, fight the car, everything, right?
mhm,
But I was able that was when I took over their medical care as I'm their doctor doesn't realize that my mom really doesn't have capacity, whereas
mhm,
I do. So I'm very much involved with my mom and her decisions that she makes. But one of the examples, the exact example that I used with my mom, because this was kind of at the tail end of COVID, around, that period of time, I said to her, I said, if you could be on a ventilator for a short period of time because you had COVID, and then we could take you off and then you'd be back at your previous, health status, then I would like to at least have the option to make that decision. So they went with that in between one
mhm.
where it's not blanket statement no, and it's not throw everything in the kitchen sink at everything that's wrong,
Yes.
but the let me decide one. But then recently she actually is very adamant that she does not want to be resuscitated
Mhm.
at all. Like,
Yeah, and this is different. So
yes,
resuscitation is different than having a temporary admission to the ICU on a ventilator.
yes,
And
accepting that she doesn't even, like, she doesn't, if something happens, she doesn't want them to do life sustaining measures at home either. She just wants it, pick
she
me up,
wants
take me to the
comfort
hospital,
care.
and let me go. And so
Okay.
I've got both of those documents now in their house. Both of them are DNR, and
Mhm.
that was actually a very interesting, emotional decision for me in this regard, because they really are still very independent
Mhm.
and not quite at that where my medical brain would say, oh, DNR is appropriate.
Mm.
Do you understand what I mean?
Yeah, I do. But I also think that I do. But I also think there's a lot of misconceptions with this because the do not resuscitate form should only be used when someone is actively dying. So they do not have a pulse and they're not breathing.
Hmm.
So that's very different than if someone is critically ill and they're still alive. So they still are breathing, they still have a pulse, they still have a blood pressure, and they're having whatever medical problem is going on. The DNR is not applicable in that situation. It's only applicable when you don't have a pulse and you're not breathing. And there are a lot of times where medical professionals will look at someone who has a DNR and over interpret it
Hmm.
and say, okay, well, they have a DNR, so they're not going to go on a ventilator or they're not going to go to the ICU. And that's actually not true. It's
Interesting.
so you need a pulse form if your state has it. That will actually identify goals of care much better than a do not resuscitate form. A do not resuscitate form is not enough. That's why I do medical decision planning because it literally only covers death. So,
I love this conversation. See, I'm learning more. I don't know that South Carolina has a pulsed form.
I'd have to look it up because I feel like I had a client recently that told me that I think there might be programs in the state but not it might not be in widespread use. So we'll have to investigate that. You can still look at the national pulsed form. So if you go to, I think it's pulsed, POLST.org, you can read the national form. And then I tell people to do this when I teach them inside of my course because it's like you're going to have to make these decisions. So you might as
Hmm.
well understand like some of how you could document this or speak to a medical professional about it. Um, so yeah, but it talks about CPR preference and then it talks about goals of care.
Hmm.
So do we want every medical intervention available until it fails? Do we want some things but not all things? And we'd prefer not to go to the ICU. Or do we want comfort focused care? I don't want to go to the hospital unless my comfort needs can't be met. And then that form can also designate if someone would want a feeding tube. And you can also put whatever else on it you want. There's like an other section, but it's a medical order form. It's signed by a medical professional and the decision maker if a person's lost capacity or the person themselves.
Hmm.
It's just like a do not resuscitate. And it's also followed by medics. So paramedics would follow it and honor it. And then people in the ER, it's much better for me to receive a document like that than it is to receive a DNR, because the DNR I can't do anything with unless someone's actively dying.
And the healthcare power of attorney is also limiting, to a large extent. So the pulse sounds like it's a much broader document for a person to understand how to direct the care for someone else. Did you know that caring for a person with dementia doesn't have to be this hard? If you are struggling and you would like to join our next free workshop, the topic of the workshop is 3 tips how to avoid challenging dementia behaviors without stress, anxiety, or burnout. I invite you to walk away with science-backed dementia caregiving skills that many professionals don't even know after attending this free workshop. If you'd like to register, message me the word workshop on Instagram or check out the link in the show notes below.
Yeah, it definitely helps define a patient's goals of care, which is so important because it's a foundation of all medical decisions. Because if I understand what your underlying goal is, then I can tell you what all the options are for treatment within that goal of care. And so, but I also want to stress that it's still not a plan, because it doesn't tell you if it's sepsis, if it's lung failure because the brain's failed, or if it's lung failure because the heart's failed, what to do. So, and that's why I teach this for people, I think, to get the most benefit out of what I do. It's like they think that their person values quality of life, and they think that at some point their person's not going to want all care. And then they also want to know when to focus on comfort. Like, those are the people I can help most. If people
So you really develop a comprehensive plan, a medical plan for people.
Yeah. So I give information. So I try to.
Yeah, you can't do everybody.
Well, and I try to be as unbiased as possible. But basically, it's like, these are the conditions that you really need to understand when you're making medical decisions for someone who is aging, and specifically living with dementia. And here are the treatment options: full treatment, some things, but not all things, versus comfort care. And these are the treatments that would fall underneath each of these goals. And it's like, I present all of the information so that the family the decision maker can decide what's okay and what's not okay. And I tell people, like, this isn't an advanced directive, right? Like, you can't create that for your person, but you can create a plan for what you're going to do on their behalf. So that's what I teach people to do. And I tell them, like, when you go through my training, choose what you would do. Like, actually go through the mental exercise.
Make the decision.
Making a choice, right? It's not to be turned in anywhere. It's not set in stone. Obviously, there are going to be variables.
Yeah.
Right. But I teach people, like, these are the questions you need to ask when your person is septic, or these are the questions you need to ask if your person's been diagnosed with cancer. It's like, how do we navigate this whole thing? So, because I just really feel like this is a piece of stress that people carry around. It's like a lot of uncertainty that I just think is you can't get rid of it all, but I just think the level of stress that people carry around is unnecessary.
Oh, I 100% agree with you. But prior to talking to you, I didn't even realize what's all included in your plan and in your program, and truly how beneficial it will be for a family caregiver to sit down and do something like this. Because, what do you get told when you go to the doctor? You need a medical power of attorney, you need a power of attorney for financial decisions, and then it's crickets. There's really nothing else.
Yeah, it's such a hole in our system. And I think it's because, we don't have the time. And we do not have the time. And I personally, like, if I was a primary care doctor, I would probably create education for each disease that I managed all the time with my patients. And I'd be like, look, you want me to be your doctor? I need you to sit down and I need you to watch these videos, because then when you come to the visit with me, we're speaking the same language, right?
Yes.
And so that's what I'm trying to give people. It's like, so that you can understand why we're making the decisions that we're making. And when something doesn't seem right, you're like, oh, I don't feel like this is right. You know what questions to ask, and you kind of know like what's standard of care, what to expect, so that you're like, this seems wildly off what I know, so that you can question, because I feel like in this day and age, the hospital is so fast paced, doctors' offices are so fast paced, you can easily fall victim to protocols, instead of actually thinking about what's best for the person as an individual.
Yeah,
Um, so it is, what I do, this is like an 8-week program that I put together.
mhm.
It comes to people weekly, and then they get access to it for forever. So the way that I envision, well, the way that it works really is that you can go through the process and create an actual written plan with this like spreadsheet that I made.
I love
And then
spreadsheets.
and all the information. But you can also, if you're like in a situation where you're just overwhelmed, you have so much stuff going on, you can still purchase the course, and then you can let it drip to you and then use it as a reference. So you can log in and watch the video on urinary tract infection or
Mhm.
pneumonia or whatever. And then when you actually have the bandwidth, you can go through the process of planning. And this year I raised the price of my course because I want to be personally involved with all my clients. I want them to be successful. And so I'm having people send me their person's depersonalized, organized, and gathered medical history so
Mhm.
that I can record myself analyzing it and telling them what they need to focus on planning now, what their person's most at risk for, looking at the medications, because that's a big thing.
Mhm.
Like that's so individualized. And then if there's like holes in what I teach, because I just had a client that sent me her thing, and her husband has non-Hodgkin's lymphoma. And I don't teach about non-Hodgkin's lymphoma. I teach some general information about how to navigate a diagnosis of cancer, but like I'm not a non-Hodgkin's lymphoma expert. So, but I can research some things for her and kind of help her, navigate that. So that's what I'm doing. I'm recording an analysis of what I think they really need to focus on in the course, and just
So you have
brain
like
dumping
so you
information.
have like the course, and then you have a little bit more of a high touch one-on-one touch point with you?
Yeah, so for everybody this year, I'm doing a one price thing. It's $697 one
That
time.
is ridiculous, Brittany.
Well, I just want people to have
I
access.
know, I can tell your heart. I can tell, but you know that that is tremendous value. I mean, people have to understand that that is like pennies on the dollar for what they're
It's
going
it's
to
100%
save.
worth the cost of it.
Absolutely.
Yeah, it is. It's worth more than that. But
Oh, for
when
sure.
when people go to see attorneys and do their financial planning with a financial advisor or lawyers, you're spending thousands of dollars. But this information that I teach is not just applicable to the person you're advocating
Mm-mm.
for. It's applicable to you, because I explain all the big things that people need to understand. So but anyways, I'm really, really excited about it this year. And I'm working with that. I get to work with clients individually. And we don't have to set up a time to talk either, because it's
Mhm.
all electronic. So they send me their information, and then I record myself analyzing it. I work night shifts, I work full time. So I'm
You're a
doing
busy
all of this
lady.
in between, but because eventually I will leave the emergency department. I just
I
don't know when.
Yeah, I understand. Wow, this has been fascinating. So tell people where they can actually find this course, because
Yeah.
I'm strongly recommending people do this. And people need to do this like before they hit the crisis.
Oh,
You
100%.
know, they can't
Yeah.
wait. This is one of those things you do shortly after you get a diagnosis, or when you're in the smooth sailing part, as opposed to the papaya hit the fan and things are falling south and we're in the hospital.
Yeah. Yeah. I think a lot of people come to me after they've had some clients that recently came because their person kept going to the ER and they were wondering if this was even necessary. Someone else whose person they treated for cancer, and she was like, people were telling me, why did I do that? And so a lot of times people are second guessing or regretting their decisions. So I would love to help people ahead of that. But if you go to blammd.com/plan, that's the page with all the information on the course and the frequently asked questions and what's included in it. And then you can sign up for it through there. And I'm not sure when this is airing. But I am doing $100 off until the 31st of January. So
Yeah, this will be a little later than that. It's been rough.
no, it's okay. But yeah, if I maybe what I'll do is if people come, you can tell me that you came from Lizette and I can give you a $100 $100
Like a
refund.
little coupon, or maybe we
Yeah.
could put a coupon code in the show note.
Yeah, I can actually I didn't think about that. Yeah, I can figure that out.
Yeah, that'll be cool. That'll be really cool. Well, thank you so much for, this is something I need to do for my mom. Like, more for my mom than my dad. My dad's a whole nother story. What can I say?
Yeah.
But I mean, if I do it for my mom, I'll automatically do it for my dad because I know
Yeah.
both of their medical decision, all of their medical stuff I know now. But I think it would be helpful for me to do with them, even though I am a healthcare provider. I think it would be helpful. So I
Yeah.
want people to realize that everybody needs to do this for ourselves, especially when you're the decision maker for someone else.
Yeah. And I'm hoping that it will become more of a common thing that happens within the system. But I just feel like right now it's like we're too taxed, and the amount of information that I teach inside of this course would be so many doctor's visits, just them teaching you. But it will help people become prepared for having conversations when they're in the situation, when they're in the office or the ER or the hospital. So yeah, thank you
Well,
for
I think
having
you
me.
have a wonderful product, and I think you've identified a tremendous lack, like hole in the system. Like, it's truly a lot bigger problem than a lot of people realize.
Yeah, it's extremely apparent when you come into the ER.
But you
Like,
know what? I don't even think it's apparent to everybody who's a healthcare provider, Brittany. I really don't. A lot
yeah,
of people don't identify these things. They just do the rote thing. They've been doing it
mm,
for so long. They just follow the protocol. They just,
mm,
the system takes over.
yeah,
And a lot of, I hate to say it, but a lot of doctors are not like you.
yeah. I think we're burnt out. And for me, I saw myself that, after COVID, I'm in my mid 30s now, but after COVID, I was like, I can't do this for the rest of my life. I need to do something I feel really good about. And I can tell you a lot of days I work in the nights I work in the ER, I don't feel good about what I'm doing. And it's because I feel powerless to help people a lot of times because of the way that things are structured, or just the lack of time and the lack of
Mhm.
access to information that they have. It's hard to point people of where to go. And that's from babies all the way till end of life, because we see
Yes.
everything. And it's just, I couldn't, I've always been a pusher against the rules. I've never really been a very good rule follower. So,
I love that though.
but,
You're forging a path, and I
yeah,
hope other people follow. I really, really do.
yeah,
And
me too. I'm excited to take people along with me.
oh, for sure.
So,
Well, thank you so much for being here today. This was fascinating. I cannot wait to actually go get your course and do it with my mom and dad's stuff and see
yes,
exactly what
come
we
do it
need to
with me.
do.
It's called Make Your Plan with Dr. Lamb. I don't think I
I
said that.
love that.
But yeah, that's what it's called. So I'd love to have you inside.
Awesome. Well, thank you, Brittany. Thank you very, very much for being here today.
You.
Thanks for joining me today, Success Seeker. I pour my heart and soul into this program to serve you. You can serve me by leaving a review on Apple Podcasts and join our free Facebook group, Dementia Caregiving for Families. It's a positive and proactive space to navigate dementia caregiving together. Get practical tools and find support, but without the verbal vomit. Be a part of our community where we seek to find peace of mind and ease despite a dementia diagnosis. So join today and see you next time as our flight takes off.